Well, today we are going to talk about pills as a family planning method, and specifically we are going to look at COCs, or what we call combined oral contraceptive pills. Pills are a family planning method that require daily swallowing every day of tablets that contain two hormones, progesterone and estrogen hormone, specifically talking about COCs. In this very video, we are going to look at what pills are, the types of them, and who cannot take them, what are the advantages and what are the disadvantages of using pills, and the common side effects that are associated with them. Stay tuned. Yes, I welcome you again to Dr. Malik Talk Show, a discussion or a channel where you know about your health just at the comfort of your home with zero costs. Today we are going to talk about pills, and specifically COCs, or combined oral contraceptives. Having got an introduction, let us look at the indications, or who are the people that can take, or who are the people that can benefit from using these pills as a family planning method. 1. Women who are not breastfeeding, or women who are breastfeeding 6 weeks after giving birth. They can use these pills freely, and the pills have no effect on the baby and they have no effect on them. They can use them freely. 2. These pills are good for women who have what we call dysmenorrhea, or painful periods, painful menstrual periods. Yes, a woman who has painful menstrual periods would benefit more by using these pills because they help on easing the pain symptomatically. Number 3, women who experience heavy menstrual periods. Yes, women who may experience heavy menstrual periods would also benefit more from these pills. Why? Because usually, except from organic pathologies, some of these heavy periods come out because of hormonal imbalances. So a pill that contains estrogen and progesterone would still help in balancing of your hormones. So they would benefit more from pills. 4, women who get ovulatory or ovulation pain would also benefit more in using or by using pills that are COCs, or combined oral contraceptives. Number 5, women who are concerned with irregular menstrual periods. Irregular menstrual periods means uncoordinated, or they come at any time, or they skip months or weeks and then come afterwards in uncoordinated or unpredictable way. So a woman who experiences irregular periods would benefit more from these pills, simply because most of the times irregular periods come because of unbalanced or imbalanced hormones, both estrogen and progesterone. Using these pills would benefit more a woman who gets irregular periods. Now, let us look at the contraindications, or who are the people who would not benefit, or who would be contraindicated or stopped from using this type of family planning, or using pills as a type of family planning. Pills here specifically, like I said, we mean the COCs, because they are also those that are POPs, or progesterone only pills. But in this case specifically, we are looking at combined oral contraceptives. Number 1, if you are a woman and you have blood pressure concerns, especially if your diastolic blood pressure, if your doctor checks your diastolic blood pressure and it is above 100 millimeters of mercury, you should not use this type of family planning, because it will aggravate or increase the risks of you developing more and it becoming more chronic on you. So if you have blood pressure concerns, you should not consider using this type of family planning method. Number 3, any woman who has thrombotic concerns or any issues to do with blood and clotting should not consider using this type of family planning, or COCs, combined oral contraceptives. Diseases such as DVT or deep vein thrombosis, you should not consider using these pills. Number 4, any woman with an active liver disease should not consider using this type of family planning method, because it will aggravate more of the liver disease than helping you ease it. Number 6, any woman who has just given birth, especially in the first 2 weeks of giving birth, you should wait 6 weeks after giving birth, then you consider using these pills. Even if you're breastfeeding, that will be okay, as long as it is above 6 weeks after giving birth. Number 7, any woman who is planning for a major surgery within the next 1 month should not consider using these pills, or should stop using them until that surgery is done and post-surgical time is done. Number 7, any woman who has unexpected or undiagnosed vaginal bleeding of any kind should not consider using these pills unless if the bleeding is diagnosed and it is hormonal based, not cancer based, because some bleedings are cancer based and we don't want to expose you to these hormones if there are cancers within your uterus. Number 8, still talking about cancers, in any case where there is suspected or confirmed cervical cancer, this type of family planning method is contraindicated and should not be considered to be used. Number 9, breast lumps of undiagnosed source. Breast lump means any swelling within your breast. If there is any swelling within your breast that is not clear of its source, you should not consider using these types of family planning until the lump is diagnosed and cancers are ruled out. Number 10, in any case of suspected pregnancy, that's why it's very important in any case of anyone wanting to get this, or if you want to get this type of family planning or whatever the other types of family planning, make sure you do pregnancy test to ensure that you rule out pregnancy before you start swallowing these tablets. Then there's a category of people, if you know that you smoke, and you know that you take some medicines, you should consider using POPs or progesterone only pills instead of combined oral contraceptive pills. Okay, now having looked at the contraindications, or the people who are not allowed, or the people who cannot use these types of pills, let us look at the advantages. What would be the advantages or the healthy benefits associated with using these types of pills to someone who has chosen to use it? 1, these pills have protective measures against 2 things. The first is pregnancy. Yes, they protect you against pregnancy, and when using them, you don't expect to get pregnant. Then 2, using COCs or combined oral contraceptive pills helps and prevents you from getting certain cancers, especially cancers of the female reproductive system. For example, cancers of the uterus, specifically here we're talking about endometrial cancer, cancers of the ovary, and symptomatic relief from PID symptoms. So that is an advantage that is associated with using these types of pills, specifically the COCs. Then 2, the second advantage, using these pills helps someone symptomatically reducing on the symptoms of certain female associated diseases. For example, a woman with cystic ovarian syndrome would benefit more from using these pills. Then 2, it helps on reducing 1, patterns of irregular periods. So that means for someone who has irregular periods, these pills would help on regulating them because they help in balancing the hormones. Number 2, they help in relieving period cramps, especially in women who get too much or heavily painful periods, and the cramps and the associated pains. Then 3, they help on relieving ovulation pain. Yes, to women who get pain every month, pain every mid of the month, every time. Yes, usually that pain is ovulation pain, and using these pills would help on relieving that kind of pain and set you free of them. Yes, and 4, to women who get excessive acne. Acne means like pimples all over the face, which usually come because of hormonal imbalances. These pills, specifically we're talking about the COCs, help on relieving the symptoms of acne and symptoms of PCOS, or what we call polycystic ovarian syndrome. So now let us look at the disadvantages or the common side effects that are associated with using these types of pills. Number 1, using pills or using any family planning method will not protect you and cannot protect you against STIs. Pills will only protect you against getting pregnant, but it will not protect you against getting STIs. Number 2, you expect to get some spotting, especially in the first 3 months of starting to use these pills. Yes, you get some spotting or bleeding between your periods, especially in the first 3 months of using these pills. Number 3, there is nausea and vomiting. Nausea and vomiting is common, especially in the first 3 months of starting to use these pills. So you expect that to happen. And when it happens, be rest assured that it will resolve on its own. However, if it is persistent, you would need to visit your doctor and give you the solution to it. Number 4, there is changes of bleeding patterns. So, if you've been getting heavy periods, you might end up getting very less. Or if you've been getting less, you might end up getting longer periods or lighter periods. There is change of patterns that is not specific to anyone, and this does not happen to everyone. However, it might happen to you or anyone else. Number 4, there is change of the bleeding patterns. This may be associated with either lighter bleeding or heavier bleeding. Number 4, there is changes of bleeding patterns. This may be associated with either less or lighter bleeding, longer bleeding, heavier bleeding, and any other changes, or spotting, like I had said at first. However, in any case, if this happens and it has persisted, you would visit your doctor. There is a solution, there is medicine to help you stop and control all these symptoms. Number 5, we expect that you may get some dizziness and lightheadedness or some headache on starting to use these pills, especially in the first 3 weeks of starting to use them. And still, this is normal and this happens. However, if it is persistent, you may have to visit your doctor and you get the solution to the headache or the lightheadedness. Number 6, you may get some breast tenderness. Breast tenderness means when you touch your breasts and feel like they are somehow paining you. Not really so much pain, but you feel like they are somehow swollen and somehow paining you. Yes, this is one of the common side effects, but it also resolves with time. Number 7, there is lactation suppression. Lactation suppression, in this case, we mean breastfeeding to the breastfeeding mothers. If you're breastfeeding and you're using COCs or these pills, you may expect to have reduced milk output. It is one of the common side effects, especially with the breastfeeding mothers. Lastly, there is lowered libido or lowered sex drive. There is loss of sex drive. This does not happen to everyone. However, it happens to some people. There is loss of sex drive. There is that loss of urge to having sex. You feel like you're no longer craving for sex as you're used to. You feel like you're no longer so much interested or think about sex as frequently as you used to. Still, if this happens, you need to see your doctor so that you get the solution to counteract the effect. So thank you for watching, thank you for sharing, and thank you for following. Keep following, ask whatever that you want to ask, or ask where you've not understood. We shall be here to answer you at zero costs.